This is a NCLEX practice test for basic care and comfort. This practice test consists of 40 questions about common nursing care and comfort measures that can be applied to a variety of situations. The explanations for the correct answers are included to help you understand why each answer is correct. Let's get started. 1. A nurse is performing discharge instructions to a patient who has undergone a left total hip replacement. The nurse is providing instructions on the correct use of a cane following their discharge to home. Which one of the following statements indicates the patient needs further instruction? A. I should always make sure the cane is on the left side of my body. B. I should always make sure I use both legs to support my body weight. C. I should move the cane about 10 inches in front of me when I use it to walk. D. I should move my left leg first, then my right. Correct answer, A. I should always make sure the cane is on the left side of my body. The question is asking which of the following statements is incorrect. A is the incorrect answer because the cane should always be on the strong side of the body, thus it must be determined which side of the body is strong and which side is weak. In this scenario, the right side of the body is the patient's strong side because the patient was operated on the left side. 2. A term used to refer to generalized wasting of body tissues and malnutrition is called A. Entropion. B. Confabulation. C. Induration. D. Cachexia. Correct answer, D. Cachexia. Cachexia is a term used to describe the generalized wasting of body tissues, ill health, and malnutrition that is associated with some chronic diseases. Cachexia involves a loss of fat tissue to protect the bones and joints. Clients with cachexia are at risk of pressure ulcers in addition to complications associated with malnutrition and poor health. 3. Which of the following clients is at a higher risk of developing oral health problems? A. A pregnant client. B. A client with diabetes. C. A client receiving chemotherapy. D. Both B and C. Correct answer, D. Both B and C. Some clients are at higher risk of developing oral health problems due to changes in the mouth associated with certain diseases, or an inability to provide proper self-care and oral hygiene. Diabetic clients may be more likely to develop periodontal disease, gingivitis, or mouth dryness. Clients receiving chemotherapy may have mouth ulcers or gingivitis, leading to further pain and infection. 4. A nurse is providing care for a patient who has undergone a left knee replacement. Upon assessment, she notices that the patient has redness, warmth, and swelling on the right calf. The patient also complains of increased pain in the right leg when ambulating. What would be the priority nursing action? A. Elevate the right leg. B. Perform Hohmann's sign. C. Administer anticoagulants. D. Notify the physician immediately. Correct answer, D. Notify the physician immediately. Redness, warmth, swelling and pain are all signs and symptoms indicative of a deep vein thrombosis. Thus, this is a situation where the physician needs to be notified immediately. The affected leg should be elevated after the physician is called. A Hohmann's sign should not be performed, as this is no longer recommended practice. 5. A client has developed a vitamin C deficiency. Which of the following symptoms might the nurse most likely see with this condition? A. Cracks at the corners of the mouth. B. Altered mental status. C. Bleeding gums and loose teeth. D. Anorexia and diarrhea. Correct answer, C. Bleeding gums and loose teeth. A client with a severe vitamin C deficiency has a condition called scurvy. Clients with scurvy are most likely to develop bleeding gums, loose teeth, poor wound healing, and easy bruising. 6. Which of the following interventions should a nurse perform for a female client who is incontinent with impaired skin integrity? A. Turn the client at least every 8 hours. B. Apply lotion to the skin before a bath. C. Provide perineal care after the client uses the bathroom. D. Bathe the client every 3 days. Correct answer: C. Provide perineal care after the client uses the bathroom. A nurse can help protect the skin integrity of some clients, especially female clients who are incontinent, by performing care that keeps the skin clean and dry. Providing perineal care after the client uses the bathroom promotes good skin integrity by removing excess secretions that could cause odor and infection. 7. A patient on a medical surgical unit who was admitted for chest pain. Past medical history includes DMI, COPD, CHF, and atrial fibrillation. The following information is obtained upon assessment: VS, T, 99.9, P, 62, R, 20, BP, 100/90, SP 02-91% on RA. Patient has diminished lung sounds in the bases and +3 edema in the lower extremities. The patient is currently receiving 80 ml per hour of NS through a peripheral 4. He has a Foley catheter that has put out 45 ml in the last 2 hours, however he had 70 ml of urine output the 2 hours prior. Which of the following is most concerning that the nurse should notify the physician immediately? A. Diminished lung sounds in the bases. B. +3 edema in the lower extremities. C. 45 ml of urine output in 2 hours. D. Temp of 99.9. Correct answer: C. 45 ml of urine output in 2 hours. Urine output should be at least 30 ml an hour. If urine output is less than 30 ml per hour for 2 hours, the physician should be notified. Urine output of less than 30 ml per hour becomes a cause for concern, especially when it is a change from the patient's baseline. 8. A client has fallen asleep in his bed in the hospital. His heart rate is 65 bpm, his muscles are relaxed, and he is difficult to arouse. Which stage of the sleep cycle is this client experiencing? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Correct answer: C. Stage 3. A client in stage 3 of the sleep cycle has moved into deeper stages of sleep and is more difficult to arouse. The client may have relaxed muscles, a decrease in vital signs, and may lie very still. Stage 3 of sleep is a type of non-REM sleep in which the client progresses toward REM sleep and vivid dreams. 9. A nurse is assisting a client who uses an intraoral hearing aid. Once the aid has been placed in the ear, it begins to whistle. What is the next action of the nurse? A. Try to reposition the hearing aid. B. Change the batteries. C. Remove the device and have it cleaned. D. Notify the physician that the hearing aid is not working. Correct answer: A. Try to reposition the hearing aid. An intraoral hearing aid, sometimes called an in-the-ear hearing aid, is one that is placed in the ear canal. When positioning the hearing aid, a whistling sound indicates it may be positioned improperly. If whistling sounds begin after placement, the nurse should try to reposition the hearing aid. 10. A nurse is calculating a client's intake and output. During the last shift, the client has had half a cup of gelatin, a skinless chicken breast, 1 cup of green beans, and 300 cubic centimeters of water. The client has urinated 250 cubic centimeters and has had 2 bowel movements. What is this client's intake and output for this shift? A. 420 cubic centimeters intake, 250 cubic centimeters output. B. 300 cubic centimeters intake, 250 cubic centimeters output. C. 550 cubic centimeters intake, 550 cubic centimeters output. D. 300 cubic centimeters intake, 550 cubic centimeters output. Correct answer: 420 cubic centimeters intake, 250 cubic centimeters output. This client has had a 420 cubic centimeters intake and 250 cubic centimeters output during the last shift. 1/2 cup of liquid, such as gelatin, is approximately 120 cubic centimeters, which should be added to the 300 cubic centimeters of water ingested. The nurse does not convert food to cc's, although hospital protocol may dictate documentation of the amount of food eaten, such as 1 whole chicken breast or a cup of beans. Output is urine in cc. 11. A school nurse is providing care for a student who had injured his left ankle on the playground. The student is rating pain a 6 out of 10. The nurse advises the student not to bear weight on his left ankle until he is assessed by a primary care provider. While the student waits for his mother to arrive, the school nurse applies ice to the ankle. This is a correct action by the nurse because cold A. Reduces bleeding. B. Prevents swelling. C. Relaxes muscle. D. Reduces blood flow. Correct answer, D. Reduces blood flow. Cold therapy should be used in the first 24 to 48 hours following a traumatic injury, active bleeding, and non-inflammatory edema because it causes vasoconstriction. Vasoconstriction ultimately reduces blood flow to the site, thus reducing swelling. 12. A nurse is caring for a client with araboflavinosis. Which of the following foods should the nurse serve this client? Citrus fruits. B. Milk. C. Fish. D. Potatoes. Correct answer, B. Milk. Araboflavinosis is a vitamin B2 deficiency. The client may develop cracks around the mouth, inflammation of the tongue, or sensitivity to light. The nurse should serve foods that are good sources of vitamin B2, including milk, liver, green vegetables, or whole grains. 13. A client is taking a walk down the hallway when she suddenly realizes that she needs to use the restroom. Although she tries to make it to the bathroom on time, she is incontinent of urine before reaching the toilet. What type of incontinence does this situation represent? A. Reflex incontinence. B. Urge incontinence. C. Total incontinence. D. Functional incontinence. Correct answer, D. Functional incontinence. Functional incontinence occurs when a client develops an urge to void but may not be able to reach the toilet in time. Functional incontinence may be related to conditions that cause the client to forget bladder sensation until the last minute, such as cognitive changes, or the client may have mobility problems that prevent her from reaching the bathroom in time. 14. Which of the following is part of client teaching regarding antiembolism stockings? A. Instruct the client to roll the top portion of the stocking down if it is too long. B. Stockings are applied with the toes uncovered at the end. C. Measure for thigh-high stockings from the foot to the knee. D. Stockings are to be smooth from end to end without wrinkles. Correct answer, D. Stockings are to be smooth from end to end without wrinkles. Antiembolism stockings are often applied for clients who have surgery or those with mobility problems. Antiembolism stockings reduce the chance of blood clot formation in the legs. When applying the stockings, the nurse should teach the client that the stockings should be free from wrinkles from end to end, as wrinkles can impair circulation. 15. A nurse is providing discharge instructions to a 15-year-old female following a left fibula fracture. The physician has written the discharge instructions as partial weight bearing for 2 weeks and must use crutches for all transferring for 1 week until walker is fit by physical therapy. The patient indicates she has understood the instructions when she states the following. A. I should support my body weight on my right leg. B. I can adjust the crutches once I get home if they do not feel right. C. I should place my crutches on my right side when getting out of the chair. D. My elbows should be flexed at 45 degrees when using my crutches. Correct answer, C. I should place my crutches on my right side when getting out of the chair. The patient should be instructed to place the crutches on their strong side when rising up from a chair. They should also be instructed to support their body weight on the hand grips of the crutches and flex their elbows at 30 degrees. Additionally, crutches should never be altered at home once they have been fit for the patient. 16. Which of the following reasons is the most likely cause of constipation in a client? A. Postponing bowel movement when the urge to defecate occurs. B. Intestinal infection. C. Antibiotic use. D. Food allergies. Correct answer: postponing bowel movement when the urge to defecate occurs. Clients who postpone bowel movements by either ignoring the urge to defecate or not evacuating for some reason like not being near a bathroom may be at higher risk of developing constipation. This causes a decrease in the frequency of bowel movements, slowed motility of the intestinal tract, and increased absorption of fecal water, contributing to hard, dry stools that are difficult to pass. 17. A nurse is assisting a client with a range of motion exercises. She moves his leg in a pattern of circumduction. Which movement is this nurse performing? A. Bending the leg at the knee. B. Turning the foot inward and outward. C. Moving the leg in a circle. D. Moving the leg forward and up. Correct answer: C. Moving the leg in a circle. Circumduction is the process of moving a limb in a circle. In this case, circumduction of the leg is a range of motion exercise where the nurse moves the leg in a circle, working the muscles of the gluteus maximus and gluteus medius. 18. A nurse is assisting a client to lie in the Sims position. In what position does the nurse arrange the client? A. The client lies on his side with the upper leg flexed. B. The client lies on his back with his head lower than his feet. C. The client lies on his abdomen with a pillow supporting his head. D. The client is sitting up at a 90-degree angle. Correct answer: the client lies on his side with the upper leg flexed. The Sims position is a side-lying position for clients that may be used for examinations or to lie comfortably. The Sims position involves aligning the client to lie on his side with his abdomen slightly downward. The upper leg is flexed, while the lower arm under the client is positioned behind his body. A pillow may be used to support the leg. 19. A nurse is instructing a client about how to use his crutches. Which of the following information should the nurse include in her teaching? A. Place the majority of body weight on the axilla. B. Dry crutch tips with a paper towel if they become wet. C. Use the crutches for support to lift both feet simultaneously when ascending stairs. D. Both A and B. Correct answer: B. Dry crutch tips with a paper towel if they become wet. When instructing a client as to how to use crutches for ambulation, the nurse should teach the client the importance of keeping the crutch tips dry. If the tips become wet, the client could slip while supporting his weight on the crutches. The nurse can teach the client to inspect the crutch tips for moisture and dry them with a paper towel if they become wet. 20. Which of the following is a disadvantage of using a dry heat application? A. Dry heat is more likely to cause burns than moist heat. B. Dry heat penetrates deeply into the tissues. C. Dry heat causes the skin to dry out more quickly. D. Dry heat can quickly cause skin breakdown. Correct answer: C. Dry heat causes the skin to dry out more quickly. When applying a heat application for therapy, the nurse often has a choice between moist or dry applications. Dry applications may be less likely to cause burns and are less likely to contribute to skin breakdown. However, dry heat applications do not penetrate deeply into the tissues and may cause the skin to dry out more quickly. 21. A nurse is coming onto her shift at 0700 and is assigned 4 patients on an orthopedic medical surgical unit. The first patient is post-op day 2 from a left knee replacement and has had uncontrolled pain through the night, rating the pain 9/10. The second patient is post-op day 1 and ordered an antibiotic for at 0730. The third patient has physical therapy at 0800 and is requesting pain medication 1 hour before therapy. The fourth patient is complaining of SOB and hematemesis. Which patient would the nurse see first? A. First patient. B. Second patient. C. Third patient. D. Fourth patient. Correct answer, D. Fourth patient. The nurse would see the fourth patient first because SOB and hematemesis are signs indicative of a pulmonary emboli, which can be a potentially life-threatening situation where blood flow to the pulmonary arteries are occluded. Although pain management and timely administration of antibiotics are important, they are not the priority in this scenario. 22. Which of the following signs or symptoms indicates a possible nutritional deficiency? A. Subcutaneous fat at the waist and abdomen. B. Presence of papillae on the surface of the tongue. C. Straight arms and legs. D. Pale conjunctiva. Correct answer, D. Pale conjunctiva. A client with poor nutritional intake may have pale mucous membranes surrounding the eye, or the conjunctiva. This area should normally be pink, indicating good circulation and a lack of irritation or dryness. Improper nutrition can manifest as numerous signs in the body, including bowed legs, pale mucous membranes, a smooth or beefy tongue, and poor muscle tone. 23. A nurse is preparing to insert a small-bore nasogastric feeding tube for a client's enteral feedings. In which method does the nurse measure the correct length of the tube? A. From the tip of the nose to the xiphoid process. B. From the tip of the nose to the earlobe to the xiphoid process. C. From the earlobe to the xiphoid process. D. From the tip of the nose to the earlobe to the umbilicus. Correct answer, B. From the tip of the nose to the earlobe to the xiphoid process. When preparing to insert a nasogastric tube, the nurse must measure for the correct length to ensure that the end of the tube will be in the correct position in the stomach. To gauge the correct length, the nurse should measure from the tip of the nose to the earlobe to the xiphoid process. This length puts the end of the tube in the stomach, rather than the small intestine or esophagus. 24. In which of the following ways can a nurse promote sleep for a client who is experiencing insomnia? A. Assist the client to use the bathroom 1 hour after going to bed. B. Give the client a massage after he wakes up in the morning. C. Tuck bed sheets and blankets tightly around the client once he is settled in bed. D. Give the client a pair of socks to wear if his feet become cold. Correct answer, D. Give the client a pair of socks to wear if his feet become cold. A nurse can promote sleep for a client who suffers from insomnia by removing any barriers that may contribute to sleeplessness. If a client develops cold feet, the nurse can give him a pair of socks or an extra blanket to keep his feet warm. Caring for small measures such as these may make a difference in a client's comfort level, promoting sleep. 25. A nurse is preparing to irrigate a client's colostomy. Which of the following situations is a contraindication for this type of irrigation? A. The client has an incontinent ostomy. B. The client has an irregular bowel routine. C. The client has diverticulitis. D. The colostomy bag contains fecal material. Correct answer, C. The client has diverticulitis. A client with a colostomy may need irrigation of the site on a regular basis to clear gas from the colon and reduce odor. There are some situations, however, when irrigation is contraindicated, such as when the client has a gastrointestinal illness that would be exacerbated by irrigation, such as diverticulitis. 26. A nurse is providing discharge instructions to a patient who will be discharged to a transitional care unit following a right-sided CVA. The patient is ordered a standard walker for ambulation. Which statement by the nurse is the correct discharge instructions for the patient? A. Step forward with your left foot, then with your right foot. B. Step forward with your right foot, then with your left foot. C. Pull on the walker in order to push up from your chair. D. Keep the walker 12 inches in front of you when ambulating. Correct answer, A. Step forward with your left foot, then with your right foot. When using a walker, the patient should be instructed to step forward with their weaker side first. In a right-sided CVA, the weaker or affected side is the left. A patient should never be instructed to pull up on their walker to sit up and should also remain within the 4 points of the walker at all times when ambulating. 27. The nurse is assessing a patient at 1900 who has undergone a total knee replacement. The patient was ordered anti-embolic stockings by his physician to prevent thrombus formation. The stockings were applied at 1100 and have not yet been removed. The following action taken by the nurse is a priority. A. Notify the physician, as the patient is at risk for thrombus formation. B. Remove the stockings and assess skin, circulation, and presence of edema in the legs. C. Report the previous nurse who provided care for this patient as she neglected to remove the stockings. D. Document the removal of the stockings. Correct answer: B. Remove the stockings and assess skin, circulation, and presence of edema in the legs. Anti-embolic stockings should be removed every 8 hours to assess for redness, warmth, and/or tenderness. Since the stockings were only applied 8 hours ago, the previous nurse did not neglect the patient. The nurse would document the removal or reapplication of the stockings, however, this is not the priority in this scenario. 28. A nurse is preparing to attach a TENS unit to a client who is experiencing pain. Which of the following actions is most appropriate in this situation? A. Tell the client that he may experience tingling sensations. B. Connect the TENS unit before the client goes to bed for the night. C. Tell the client that the TENS unit may have pain-reducing effects for 10 to 15 days. D. After treatment, notify the client that he may not use a TENS unit again for at least 2 weeks. Correct answer: tell the client that he may experience tingling sensations. A transcutaneous electrical nerve stimulation (TENS) unit is a non-pharmacological form of pain control that is used by attaching electrodes to a client's skin near areas where he is feeling pain. A client using a TENS unit should feel tingling sensations, but not to the extent that the muscles begin to twitch. The therapeutic effects of a TENS unit may last 3 to 5 days. 29. When cleansing the genital area during perineal care, the nurse should underscore: A. Cleanse the penis with a circular motion starting from the base and moving toward the tip. B. Replace the foreskin after it has been pushed back to cleanse an uncircumcised penis. C. Cleanse the rectal area first and then clean the patient's genital area. D. Use the same area on the washcloth for each washing and rinsing stroke for a female resident. Correct answer: B. Replace the foreskin after it has been pushed back to cleanse an uncircumcised penis. It is important to retract the foreskin of uncircumcised male patients in order to remove the smegma that collects under the foreskin. This smegma can lead to bacterial growth and infection. The foreskin is then replaced after the penis is cleaned. 30. You are ready to wash your patient's face. You would start by washing what area of the face? A. The forehead. B. The eyes. C. The ears. D. The cheeks. Correct answer: B. The eyes. The eyes are the first area to be cleaned. The eye area is considered the priority in terms of moving from an area that can be potentially infected to areas of the face and body that are least able to become infected with a washcloth. 31. Patients who cannot move in their bed on their own should be turned at least underscore: A. Once a day. B. Twice a day. C. Every 2 hours. D. Every 4 hours. Correct answer: C. Every 2 hours. Patients and residents who cannot freely move about in bed must be turned at least every 2 hours in order to prevent pressure ulcers and skin breakdown. Some need even more frequent turning. For example, a patient who is incontinent of urine must be cleaned, dried, and turned more often. 32. Cheryl M. has a serious swallowing disorder. She has asked you for a glass of water. The doctor has ordered honey thickness fluids for her. Water is not a honey thickness fluid. It is much thinner. What should you do? A. Tell the resident that she cannot have water. B. Give her applesauce instead of water. C. Tell Cheryl that she is NPO until midnight. D. Thicken the water and give it to her. Correct answer, D. Thicken the water and give it to her. You can give Cheryl the water that she has requested, however, you must thicken it with a commercial thickener before giving it to her. 33. You have been asked to record the amount of food that the person has eaten during each meal. What kinds of words or numbers would you use to record this food intake? A. A little, a moderate amount or all of the meal. B. 50 cubic centimeters, 100 cubic centimeters or 500 cubic centimeters of the meal. C. 25%, 50% or 100% of the meal. D. Either A or C. Correct answer, C. 25%, 50% or 100% of the meal. Food intake is measured in terms of the percentage, of food that has been eaten. For example, you would record 25% of the vegetables if the patient has eaten about 1/4 of the vegetables on the plate. The terms little and moderate are too vague and not specific enough. Fluids, not solid foods, are measured in terms of cc. 34. Mr. Thomas is a well-groomed 68-year-old male patient. He had prostate surgery 2 days ago. He has an indwelling catheter and a urinary drainage bag. You have weighed him at 9 a.m. each morning for 3 mornings in a row. Today, on the 4th day, his morning weight is 3 pounds more than it was the day before. Why could he have gained these 3 pounds in 1 day, on a 1,000-calorie diet? A. It is obvious that his visitors have been sneaking him junk food from the local fast food restaurant. B. It may be that his urinary drainage bag was not emptied today and it was emptied on previous days. C. It is obvious that the scale is broken and it should be replaced immediately to prevent these false weights. D. A 3-pound weight gain is not significant enough to question and should just be noted. Correct answer, B. It may be that his urinary drainage bag was not emptied today and it was emptied on previous days. It is very possible that the urinary drainage bag was emptied on previous days and not emptied today. This very often happens. Nothing is obvious. Everything should be explored and looked into. 35. The nurse is providing teaching instructions to a group of clients who will have planned orthopedic surgeries next week. She is reviewing methods to reduce the compression of leg veins postoperatively when a client voices concerns of blood clots. Which of the following statements by the client would indicate the need for further teaching? A. I should avoid crossing my legs. B. I should sit for long periods of time so I can rest after my surgery. C. I should place a pillow behind my knee. D. I should avoid restrictive clothing on my legs. Correct answer, B. I should sit for long periods of time so I can rest after my surgery. A client should avoid sitting for long periods of time to help reduce the compression of leg veins, which is a common location where thrombi are formed. The patient does indeed want to avoid crossing their legs, avoid sitting for long periods of time, avoid restrictive clothing on their legs, and should place a pillow behind the knee. 36. You are providing mouth care to a patient who is in a coma. You should underscore to provide good and safe mouth care. A. Keep the head of the bed up so that the patient does not aspirate. B. Brush the teeth and rinse the mouth with a cup of water. C. Use a special foam swab to brush only the tongue. D. Use a special foam swab to brush the tongue and teeth. Correct answer, D. Use a special foam swab to brush the tongue and teeth. Patients in a coma also need mouth care. You have to modify the mouth care procedures to meet the special needs of people in a coma. There are special foam mouth swabs that are used to clean all areas of the mouth, including the cheeks and the tongue. You cannot use water for mouth care when a patient is in a coma, so there is no need to keep the bed up to avoid aspiration. 37. This particular gland of the endocrine system secretes a hormone that is known to assist with the sleep/wake cycle. What gland is it? A. Pituitary. B. pineal. C. Pancreas. D. Hypothalamus. Correct answer, B. Pineal. The pineal gland, located in the brain, secretes melatonin. This hormone is known to regulate the sleep/wake cycle in response to exposure to light. 38. Digestion, elimination, and underscore are the three functions of the digestive system. A. Constriction. B. Relaxation. C. Adsorption. D. Peristalsis. Correct answer, C. Adsorption. Adsorption is a function, in addition to digestion and elimination, which make up the three functions of the digestive system. 39. Which of the following is an example of restorative care? A. A nurse teaches a new mother how to breastfeed her infant. B. A nurse helps a client with developing a bladder retraining program. C. A nurse places an allergy wristband on a client's wrist to notify other providers of potential reactions. D. A nurse contacts the family of a client to tell them he will be out of surgery soon. Correct answer, B. A nurse helps a client with developing a bladder retraining program. Restorative care involves helping clients regain or maintain the highest level of function that is possible for them. The nurse who practices restorative care helps clients to perform their own activities in order to promote self-care, such as through activities of daily living or certain types of therapies. A nurse who helps a client with a bladder retraining program is assisting the client with regaining bladder function. 40. Your patient has been diagnosed with a left ankle sprain. On the discharge instructions, the physician has prescribed the RICE protocol. This acronym stands for A. Rest, ice, compression, elevation. B. Radiology, ice, compression, elevation. C. Rest, ice, cast, elevation. D. Radiology, ice, cast, elevation. Correct answer, A. Rest, ice, compression, elevation. Appropriate treatment for an ankle sprain is rest, ice, 20 minutes on each hour while awake, compression, usually with an elastic bandage, and elevation of the foot above the level of the heart. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.